Once you put up an attitude, or discriminate, or are hostile, or put up a negative preconception to someone or a group of people that are suffering from substance abuse, then you have stigmatized that individual or group. According to the World Health Organization, stigma is a key source of discrimination and exclusion in a people, and it constitutes an abuse to human rights. For people suffering from substance abuse, stigmatization poses a lot of concern and can prevent them from seeking out proper care, support, and treatment. Hello and welcome to another edition of Speak Up, a program that is brought to you by Fat Corner, where we discuss social and psychological issues that are facing you and I in the world and in Africa to be precise. I am your host, Kimi Ebisine Oguniye. For the past couple of weeks, I've looked at what substance abuse is, what are the causes and the consequences, as well as what help is available. But I must say that without addressing the issue that stigmatization has on an individual with substance abuse disorder, then proper support cannot be rendered to those affected. In our previous chat with Dr. Haruna, he mentioned that substance abuse disorder is a disease and as such should be treated as one. Some of the misconception is that people that are suffering from substance abuse disorder, they are bad, they are weak, they are unfit for society, or that they chose to misuse these substances. But in actual fact, it is not always so. Some substance abuse disorder can begin from being prescribed that medication by a doctor. Or it could be genetic that could be completely out of their control. Or it could be something they've been exposed to right from their little age, and as such, they have no strength to overcome it anymore. So, by stigmatizing such individuals, we are contributing to their illness. There are three types of stigmatization that is associated with substance abuse, and there are the self, the social, and the structural. A self-stigmatization, it describes the negative feelings that a sufferer puts on themselves. People having substance abuse disorder already begin to feel they are not good enough. They begin to see the weakness. And so instead of seeking for help, they stigmatize themselves and fall back into the depression and going back into continuous use of that substance. And that needs to stop. Do not stigmatize yourself because of what you're going through. The next one is a social stigma. This is also known as a public stigma. It comes from the society, from people around those that are suffering from substance abuse. It comes from the friends, the family, the people who are supposed to help these people, other people stigmatizing them. Some of this is come from the image that is put out there in the public. The movie, social media puts this perception that people suffering from substance abuse are bad people, and as such, it becomes a stigma that is out there for the whole world to see, and these affect them a lot. The third one is the structural stigma. This is ingrained in the system. The institution that is meant to support people with substance abuse disorder begins to stigmatize these people themselves. It affects the level of investment in and in the quality and effectiveness of specialist treatment and support services that can be rendered. An example is where the healthcare provider will tactily see a patient's drug or alcohol problem as their own fault, leading to a substandard care or even rejecting the individual seeking treatment. Some is where people that are showing signs of acute intoxication or withdrawal symptoms are sometimes expelled from emergency room by staff that are fearful of their behavior or that are assuming that they are only seeking more drugs. These are some of the effects of structural stigmatization. People with this problem internalize this stigma, making them feel ashamed and refuse to seek treatment as a result of it. Another form of structural stigma is where the practitioners, doctors, nurses, people who would have gone into the field of supporting people with substance abuse disorder are themselves stigmatized. And as such, you have very little personnel in those fields to be able to support people going through structural substance abuse disorder. And this stigma needs to stop for people to receive proper support that they need. Stigma hurts. Stigmatization, it hurts. It can negatively impact a number of areas, including the willingness to attend treatment and access to healthcare. Unfortunately, people who experience stigma regarding their substance abuse problem are less likely to seek treatment. Another way it can affect them is harm reduction, and I'll explain this. Stigma can affect the public's preconception of evidence-based harm reduction strategies. Due to widespread stigma about those who use drugs and who suffer from addiction, these interventions are not usually supported by the public and are believed by some to facilitate and encourage drug use. Stigmatization therefore affects the level of the investment in and the quality and effectiveness of the specialist treatment and support services that can be given to people suffering from substance abuse. Another way stigma has an effect is on the self-esteem and the mental health of individuals that are going through substance abuse disorder. And finally, stigma also has impact on the families, the friends, and the broader community of people with drug problem. This impacts on the family members' ability to support the people with substance abuse disorder. A lot of people are ashamed. They do not want to own up to the fact that their family members are going through this, and so they do not want to support them. So they hide these things. They are hidden in different ways where instead of giving them help was seeing them as a problem because of the stigma that the family members of those going through this challenge go through themselves. To be able to help these people, we need to stop stigmatizing the people going through it, the institution that is meant to help, and the family and friends of people that are having substance abuse disorder. I'll look at some ways that we can effectively help to reduce the stigma. And the first one I want to look at is offering compassion and support. Offer compassion, offer support. Display kindness to people in vulnerable situations. So many times the world is so vast that people begin to show empathy is completely lost, and people just begin to give a negative vibe to people who are going through situations. But no, let's show kindness. Another one is listening without while withholding judgment. We are so quick to judge these people. Let us not judge them. Let us listen to what they are going through, listen to the challenge that they are having, and find a way to support them and not judge them at all. Let's use our words carefully. Harmful words trigger emotions, leading to stigma and leading them back to use of those substances to feel better, because we've hurt them with our words. So we are not helping them get better. We're just making them worse because they go back to those substances. It's a vicious cycle. Another thing is seeing a person for who they are and not the drugs that they are using. See them for what they were, what potential you see in them. Look at them and not look at the circumstance that they are going through at that time. Another way to help is do your research. Learning about drug dependency and how it works can help you and give you a new perception on how to help these people, because you know better what they are going through. The next one is treating people with drug dependency with dignity and respect. They are still fit for the society and family. Treat them with dignity. Avoid hurtful labels. Replace negative attitude with evidence-based facts. And finally, speak up when you see someone that is mistreated because of their substance abuse problem. I cannot say this enough. In order to encourage people to reach out for help and get to the path of recovery, it is important that we reduce the stigma that is associated with substance abuse disorder. And this is where I stop for today. Thank you so much for listening. And if this is your first time here, or if you haven't liked or subscribed to Fat Corner, please kindly do so by hitting the like or subscribe button on Facebook and YouTube. It's at Facts in block letters and Corner in small letters. If you have any questions or comments, please feel free to get in touch with me by sending an email to info@fatcorner.org or through a direct message on our Facebook page at fatcorner.org. You can also put your comments in the comment section of this broadcast. Thank you. Until next time, speak up.